So let's talk about mystery cases, hidden causes, and scary accurate results. Have you guys ever gone to the doctor and I don't know, they do blood work, everything comes back normal, and we don't know why you have your symptoms, but here, we're going to give you a pill, you know? Um, or they kind of guess at the diagnosis. Well, it could be this and it could be that. And, we're going to try you on some medication. And if that doesn't work, then we're going to go in this direction. Or I love it. They don't know the reason. So they give you an autoimmune diagnosis. It's just your body's attack. Actually, that's what happened to me. So I know that that actually does happen. And they wanted to diagnose me with an autoimmune disease because they had no clue what the underlying cause was. Okay. So I was a mystery. All right. And so I got diagnosed with an autoimmune disease. And the causes are often missed by Western medicine practices. So these are hidden. And sometimes you feel like you're going nuts because you're telling your doctor and they're just like, well, there's nothing wrong with you. All your lab work came back fine, you know? So yeah, kind of not fun. And you think you like literally are going nuts and then you start to think that maybe it's all in your head because the doctors might oh, it's just your anxiety or it's just depression, right? Or I love how I got actually diagnosed with bipolar when it had nothing to do with that. And then you're put on a whole bunch of medications. And then before you know it, you are feeling like poop. Even more so than what you were before because now you got side effects from all the medications that you were on. And then you're taking more medications to handle the side effects that you of the first medications that you were given. And it just like, when does it stop? So, what are some of these hidden causes? Okay. And what are some of the mystery cases? Oh, so I had a patient that was diagnosed with an autoimmune that was affecting her vascular system, and she would get ulcers all up and down her leg, and she was on um immunotherapy, and she was still getting outbreaks even with the immunotherapy, and she would get like tingling and sensations in her legs, and then she would break out into small ulcers, and it would happen right before her next treatment was due. And we through quantum nutrition testing, we found out that she had some toxins and she also had some parasites in her system. And by removing some of the toxins, by removing the parasites, her time frame of needing like how frequent that she needed immunotherapy started stretching out further and further and further. And she has not had any immunotherapy in over 8 months, maybe even a year, which is amazing because her doctor told her that she would never be able to come off of this. Now, not to sound goofy, but if I was a doctor and I didn't believe my patient could ever come off of this, I'd be turning around and trying to find out, well, what did that other practitioner do to help my patient get better? That hasn't happened. Just FYI. So, and to me that's amazing. That is awesome. So, a lot of times these issues that you have, there's hidden causes that are often missed by standard medical testing. So, Why can you not find parasites in stool samples? Well, I did a stool sample and it came back clean. That's great. But guess what? There are other areas where parasites can be at. Not only that, but the stool sample is only checking a small portion. It's not a full picture of what's going on with your intestines. A colleague of mine, Dr. Sarah Outlaw, explained it beautifully, and I use this reference all the time because she explained it so easily. So it's kind of like almost like a bag of Skittles. Okay. So you have a brand new bag of Skittles. You have all the colors in the brand new bag of Skittles. You know you have all the colors in the brand new bag of Skittles. And you just dip your hand in and you have no green Skittles in your handful that you just grabbed. Does it mean that there's no green Skittles in the bag? No, it's a brand new bag. You know you got the green Skittles in there, but they all settled to the bottom. Okay. It just means that you don't have any green Skittles in your handful. That's like poop samples and parasites. Literally, that's what poop samples and parasites are like. Parasites can go migrating. CDC actually recognizes this. So parasites can form cysts and go migrating. And they actually form cysts to protect themselves so your body cannot kill them off. And they can be in your head. CDC recognizes this. They can be in your bone marrow. That's also like there's research articles that showed that parasites can be in your bone marrow. These things can be all over in your liver, in your lymph nodes. I actually just had a patient that has an enlarged lymph node, and it's not tender or anything, but there's a concern for it. And she's quantum nutrition testing for parasites. So we're going to start her on a protocol and see where it goes. So I am anticipating that that will start decreasing. So anyway, these suckers can be anywhere. So heavy metals is a big one. So heavy metals, heavy chemicals, where do we get this? Pretty much all over the place. So from deodorants, from shampoos, from body washes, from um, lotions, toothpaste, cookware, medications, um, makeup, cologne, nail polish removers, scented candles, fragrances, even from your clothes. Did you know that a lot of the clothes, especially workout clothes, unless it's 100% from cotton, the stuff that wicks away moisture while you're working out is actually plastic material that actually can get into your bloodstream, and they're forever chemicals, guys. So your workout clothes, there's lots of ways that you can get heavy metals and heavy chemicals, and these are often missed. They can cause joint pain and inflammation. They can cause gut issues. Like red dyes have been linked to hyperactivity, so ADD, ADHD, gut issues, and also linked to colon cancer. Not so fun when you think about it. Um, Mercury has been known to mimic arthritis. So people with a lot of joint pain and inflammation could be from mercury, high levels of mercury. Aluminum can cause lots of things, brain fog, headaches, many other issues as well. That's in your Tums and your antacids, your deodorants. So aluminum tinfoil for cooking, just to name a few. So these are often missed, causing tons of symptoms. Also, if you are on medications, check the side effects of your medications, because chances are some of your symptoms might be actually from the medications themselves. And then people, like they'll say, well, Tracy, I stopped the medications, but I still have the symptoms. So it must not be from the medication. Not necessarily. You can have more causes, multiple causes to your symptoms. We have to eliminate all of them. So you could have parasites, heavy metals, and side effects from the medications. If you're only removing the medications, are you going to get rid of your symptoms? No, you have to remove all of them. So just because your symptoms don't stop after removing the medications doesn't mean it wasn't caused from the medications or partly to blame from the medications. Again, there could be multiple reasons why you have your symptoms in the very first place. So some people will tell me, like, well, Tracy, I had this back pain and I did acupuncture or I did chiropractic and it didn't help. That's part of the equation. So chiropractic and acupuncture do help. But if there are other reasons why you have your symptoms and you're not eliminating all of them, then you might not notice any change with chiropractic or acupuncture. Does it mean it's not working? No, it just means you have multiple layers to your symptoms because there has been multiple studies that show that chiropractic and acupuncture do help. But again, if your symptoms are because of multiple issues and you're only addressing one, your symptoms aren't going to get better. You have to address everything. So, and that's what we do. We look for those hidden causes that are missed. So, like for instance, I just had a patient with vertigo, and I've experienced this. How many people out there have vertigo or dizziness? And you guys are on meclizine or Antivert? It's a medication that helps with dizziness. Did you know that your dizziness and sometimes one of the treatments for dizziness can be giving a steroid. Okay. Well, guess what? Dizziness and vertigo can actually be a sign of adrenal fatigue. Okay. So, and meaning that, and what happens a lot of times is, and I see this in practice, is the adrenal glands are going a mile a minute. They're actually on overdrive, and they're on overdrive where they're not really doing a very good job. They're actually, going so fast and they're going like a Mach 40 that they're actually doing a poor job, that they're not very efficient. So it looks like adrenal fatigue when they're really going a mile a minute. And so the steroids can actually turn around and kind of calm down the adrenal glands, but then you can wind up going into adrenal insufficiency if you're on steroids too long. So that's why, and there is more research articles, and you can actually look this up. There is a link between dizziness and vertigo and adrenal fatigue. I don't know about you, but I experienced that once. And my quantum nutrition testing practitioner, so the one who tests me, so I don't test myself, and that's for other reasons. So I have a practitioner that tests me. And if my adrenals are going, if my adrenal gland at one point was really, really on overdrive. And I just laid there in bed and I got so, like, I just felt like everything was spinning. Like I felt like I was spinning. And I almost got nauseous from it. And I almost thought I was falling out of the bed when I was even just laying in the middle of the bed. And heaven forbid I turned over at any point. Oh my gosh, that was just horrific. I didn't even want to move. And I'm trying to remember exactly what my cause was. Each person has something different, or it could be from parasites, but there's a lot of things. It's whatever's irritating the adrenal gland. I think mine was from parasites and was it from heavy metals? Oh no, mine was from mold and parasites. So I had mold and parasites irritating my adrenal glands. And once we started handling that, then my symptoms actually started decreasing significantly, to the point where they actually went away. It took a little bit, but and I haven't had it since. So there's a reason why you have your symptoms in the first place. And what we want to do is we want to find out, well, why? What organs are being affected? And then the underlying cause. Is it toxins? Is it food intolerances? Maybe you're eating foods, and yes, you can. Maybe you're eating foods that are causing inflammation within the body, not necessarily an allergy, but inflammation within the body. Okay. Maybe it's Lyme, maybe it's mold, maybe it's candida, maybe it's bad bacteria, maybe it's parasites. What is the underlying cause? And then we can find out specifically what supplements your body needs to get rid of the underlying cause while giving nutritional support. And through quantum nutrition testing, a lot of things have been able to be helped, including vertigo, dizziness, hormone balances, blood pressure issues, sleeping issues, energy issues, gut issues, mood between anxiety and depression, and headaches, migraines, neuropathy, heavy periods, irregular cycles. So all of these things can actually be helped. And in fact, on average, most of the patients that I see have anywhere from a 25 to 50% improvement of their overall symptoms in just 3 months. That's pretty significant. I have more now. There are some patients that have less than 25. I'm not going to lie about that. I have more patients over 50% than under 25%, though. So, if you would like more information on how we do quantum nutrition testing or how it may help you, give us a call, 708-554-6730. Happy Halloween. Have a good one.